Symposium on Global Health and Health Issues in the Philippines. And the first thing we're going to do is we're going to have our 3 B&D scholars speak first. And following that, I have 3 independent study students, and I'll introduce each person. So, with no further ado, I would like to introduce our first speaker. And our first speaker is Philip Paragas, and Philip is going to talk about AIDS as a global health problem and AIDS in the Philippines. Phil's an RN to BSN student, so he is a nurse and he's almost going to graduate soon with his bachelor's. So I thank you, Phil, and you are first to speak to talk about HIV/AIDS as a global health problem. So please come up on the stage.
Thank you, Dr. Sternas. Good afternoon, everyone. Thank you for attending. So the topic was HIV/AIDS as a global health problem, and in particular, the Philippines. Next slide. Purpose was to discuss HIV as a global health problem and the Philippines. Next slide. So what is HIV? HIV is the human immunodeficiency virus. It is a virus that can lead to acquired immune deficiency syndrome, more commonly known as AIDS. HIV damages a person's body by destroying specific blood cells called CD4 plus T cells, which are crucial to helping the body fight diseases. It's just a diagram of what the HIV virus looks like. So what is AIDS? AIDS stands for Acquired Immunodeficiency Syndrome. Acquired meaning that the disease is not hereditary but develops from after birth from contact with a disease-causing agent, in this case HIV. The I stands for immunodeficiency, meaning that's characterized by a weakening immune system. And the S in AIDS stands for syndrome, refers to a group of symptoms that indicate or characterize a disease. In the case of AIDS, this can include the development of certain infections and or cancers, as well as a decrease in the number of certain specific blood cells. Next slide. So how is HIV spread? The 3 ways it could be spread are through sexual transmission, blood transmission, and mother-to-baby transmission. And I'll go into more detail with those. Next slide. So sexual contact, meaning you have unprotected sex with someone who has HIV. Can also include having multiple sex partners or the presence of other sexually transmitted diseases, which increase the risk of infection during sex. Unprotected oral sex can also be a risk for HIV transmission. And next slide. So the second form of transmission was blood transmission, meaning you come into direct contact with infected blood from HIV positive person. This includes sharing needles, syringes, accidental needle sticks in a hospital, things of that nature. Next slide, please. And third was the mother-to-child transmission. HIV can be passed from mother to child during pregnancy, birth, or during breastfeeding. So here are some statistics on HIV in the United States. There are about more than 1 million people living with HIV in our country. An estimated 56,300 Americans become infected with HIV each year. And men who have sex with men of all races remain the group most severely affected by HIV. And just comparing it, HIV in Africa is a major health concern in that country. Although Africa is inhabited by just over 14.7% of the world's population, it is estimated that more than 88% of all people living with HIV are in Africa, and 92% of all AIDS deaths occurred in 2007 over there. So now looking at the numbers in the Philippines, the total population in that country is about 99.9 million, and the estimated population living with HIV/AIDS is about 8,700. So the adult HIV prevalence is less than 0.1, which is quite low. This map just gives us a global perspective of HIV prevalence. The red and the dark red colors indicate the highest rate, while the white color indicates the lowest rate. So as you can see, throughout Africa, it's quite high compared to the rest of the world. Next slide. So in the Philippines, their response to address the HIV/AIDS problem was wary of, they were wary of the unfolding epidemic in neighboring countries, so they wanted to address this issue. Some responses they did included the National AIDS and Sexually Transmitted Infection Prevention and Control Program, the Philippine National AIDS Council, HIV/AIDS Surveillance System, and AIDS Medium Terms Plan, and then the Republic Act 8504, or the Philippine AIDS Prevention and Control Act of 1998. That act actually mandated the promulgation of policies and prescription measures for HIV prevention and control in the Philippines, the institutionalization of a nationwide information and educational program, and the establishment of a comprehensive AIDS monitoring system. So financing for this in the Philippines, from the years 2000 to 2007, the average total spending for AIDS was about 311 million Philippine pesos, which is about 7,400,000 US dollars. In terms of spending by activity, they spent the most on prevention of HIV, followed by program support costs, treatment, and care activities. So most of the money went to preventing the disease. The first HIV case in the Philippines was detected in 1984. Since then, the estimated number of people living with HIV in the country grew from 2,200 in 2001 to 8,300, with an estimated 2,200 cases among adult women. Overall, the HIV situation in the Philippines has been characterized as hidden and growing, although the HIV prevalence remains below 0.1%. So this picture just gives us a diagram of some of the main symptoms of acute HIV infection. Commonly, you'll see fever, weight loss, mouth sores, malaise, headaches, and I'll go into more detail in the next slide. So some early signs and symptoms of HIV. Within the first few weeks of contracting the disease, you may have no signs or symptoms at all, although you are still able to transmit the virus to others, which makes it very dangerous. Many people develop brief flu-like illnesses for 2 to 4 weeks after becoming infected. Signs and symptoms may include fever, headache, sore throat, swollen lymph glands, and rashes. And some later signs and symptoms. You may remain symptom-free for years. As the virus continues to multiply and destroy immune cells, you may develop mild infections or chronic symptoms such as continued swollen lymph nodes, diarrhea, weight loss, cough, shortness of breath. So that's why with these signs and symptoms, you can remain symptom-free. That's why testing is very important, especially if you are at a high-risk candidate for it. So HIV progresses to AIDS. If the person receives no treatment for HIV infection, the disease progresses to AIDS in about 10 years. By the time AIDS develops, the immune system has been severely damaged, making the person susceptible to opportunistic infections, diseases that wouldn't trouble a person with a healthy immune system. The signs and symptoms of some of those infections may include soaking night sweats, shaking chills or fever, cough, shortness of breath, chronic diarrhea, persistent white spots or unusual lesions on your tongue or in your mouth, headaches, persistent unexplained fatigue, blurred and distorted vision, weight loss, and skin rashes or bumps. So prevention for HIV includes abstinence, following safe sex practices, also drug rehabilitation with needle exchange programs, not for drug users not sharing their dirty needles, and also protection when caring for patients, such as avoiding contact with infected blood if you were in a hospital, also the prevention of accidental needle sticks. So treatment for HIV. This is the main type of treatment for HIV. It is not a cure, but it can stop people from becoming ill for many years. The treatment consists of drugs that have to be taken every day for the rest of the person's life. The aim of antiretroviral treatment is to keep the amount of HIV in the body at a low level. This stops any weakening of the immune system and allows it to recover from any damage that HIV might have caused already. These drugs are often referred to as antiretrovirals, ARVs, anti-HIV, or anti-AIDS drugs. And that was pretty much a summary of the presentation. Any questions? No? Cool. Thanks.
Thank you very much, Philip, for your excellent presentation. Our next speaker is Stephanie Rigor, and Stephanie is going to talk about dengue fever. And she is a B&D scholar, as is Philip, and I welcome her to the podium. Stephanie is an undergraduate student, and the other piece about Stephanie is she actually happened to be able to get some interviews. Is Stephanie not here? There. I'm looking. Where are you? Because I know you came. Okay, she actually got some interviews with nurses. So she had a little survey she put together. She emailed it off to the Philippines. And these were nurses who cared for persons with dengue fever. So she'll incorporate that into her presentation. So Stephanie, please. Thank you. I need to set up your...
Okay, so I did my presentation on healthcare in the Philippines with further study on dengue fever. So the truth behind dengue fever is next to malaria, dengue fever is a tropical infectious disease that has caused many deaths upon Filipinos. Dengue is an acute infectious disease of sudden onset, manifested initially with a fever, which is caused by the bite of the striped Aedes aegypti mosquito, which is right here. Okay. Infection with the disease virus causes a spectrum of clinical... Okay, infection with the dengue virus produces a spectrum of clinical illnesses ranging from non-specific viral syndrome to severe and fatal hemorrhagic disease. Dengue is a potentially life-threatening disease that Filipinos have no choice but to face with diligence. Okay, so here you can see that it's prevalent throughout the tropics and subtropics. So all those countries highlighted is where the dengue mosquito has, that's where a lot of the epidemics have been shown throughout the country. Next slide, please. Okay. Prevalence in the Philippines, the epidemic of the dengue fever. As urban areas and newly emerging urban environments continue to expand, the prevalence of dengue has now spread to more than 100 countries throughout the South and Central America, Africa, the Caribbean, Eastern Mediterranean, Southeast Asia, India, and the Western Pacific. It has affected over 2.5 billion people, which is 2/5 of the world's population where the virus has been transmitted. Particularly in the Philippines, the number of people afflicted with the dengue virus has reached 11,803 in the first quarter of 2010 last year. And that's only between January 1st and March 27th, 2010. The number of dengue cases in the Philippines usually arises in the summertime during rainy season, as mosquitoes breed in flooding areas. The spread of dengue is contributed to the vast amounts of still water stored throughout households and inadequate sewage disposal in densely populated regions. Okay, so back in January, we went to the Philippines and we visited a grade school, and there was a health fair provided by nursing students. So on the left, you can see all the little kids talking to the nursing students, and on the right, you can see a sign that says, Bulili, Bulili, Malayo Sasakit. In Tagalog, translation is, young ones, stay away from sickness. So they had a whole day of programs of fun activities and posters and awareness for the kids to see like what kinds of common sicknesses and illnesses that they'd be inflicted with in the Philippines, and dengue fever was one of them. So next slide. And this is the poster that the nursing students from the Philippines made for the children. Causes of transmission. Dengue is an acute fever caused by a virus transmitted by the Aedes aegypti mosquito. It's a day-biting mosquito which lays eggs in stagnant water found in flower vases, cans, rain barrels, and old rubber tires, and so on. These mosquitoes rest in dark places of the house. The female mosquitoes lay eggs in water containers in and around the homes and other dwellings, and these eggs will become larvae, and further develop into adults in about 10 days. The mosquito flourishes during rainy seasons and can breed all year round. Okay. Dengue is an acute fever caused by a virus and may occur in two forms. One is dengue fever, and the second is dengue hemorrhagic fever. Now I'll explain dengue fever. It starts with a sudden high fever with severe headache, pain behind the eyes, muscle and joint pain also. It's frequently accompanied by sore throat, dizziness, loss of appetite, vomiting, and diarrhea. And dengue hemorrhagic fever is a more severe and potentially deadly form of the viral illness where bleeding and shock may occur. Manifestations include fevers which last for 5 to 6 days with a rash and evidence of hemorrhage in the body. You'll see petechiae, bleeding in the nose or gums, black stools due to bleeding. Easy bruising are all possible signs of hemorrhaging, and incubation periods range from 3 to 15 days. This form of dengue fever can be life-threatening and can progress to more severe forms of the illness, which is dengue shock syndrome. So there are different stages of dengue hemorrhagic fever. Stage 1, symptoms of high fever as high as 104 to 105 degrees. You'll see fatigue, restlessness, and generalized rashes. Stage 2, you'll see the hemorrhagic symptoms such as nose bleeding, gum bleeding, stuff like that. In stage 3, you'll see manifestations of hypotensive shock, which includes decreased blood pressure, cold and clammy extremities, narrow pulses, decreased respirations, pleural effusion, decreased hemoglobin, hemodynamic concentration, and decreased hematocrit lab values. Organ impairment may be present in this stage. And stage 4, which is most serious, if the symptoms have been left untreated, it could lead to death. So here you can see all the different pictures. Top left is a picture of a mosquito, and top right as well. The bottom left, you'll see the bleeding in the eyes from the hemorrhaging, and the bottom right is the rash that you'll see. On a physical examination of a patient, it may reveal enlarged livers or hepatomegaly, low blood pressure, red eyes, red throat, swollen glands, weak pulses, and more serious complications like encephalopathy, liver damage, residual brain damage, seizures, and shock. Diagnosis of dengue fever. The presence of the virus of this disease in the body can only be attained through blood tests in the laboratory. These tests may be done to diagnose this condition may include arterial blood gases, hematocrit platelet counts, antibody for dengue virus types, CBC, serology studies for antibodies for dengue viruses. Okay. To raise awareness in the Philippines, they have certain advertisements, and here you can see this advertisement taken from the Philippine Daily News. And this translates roughly to stop dengue fever and kill all the little bugs. Next slide, please. The Populations targeted for dengue fever are parents and adolescents, and they're provided with education on prevention of dengue fever. And younger children are encouraged not to play in places where breeding sites of mosquitoes. Dengue fever is caused by a virus that does not have a cure or vaccine just yet. So treatment is supportive to treat the symptoms. So you'll see transfusions of fresh blood or platelet scans correcting bleeding problems. Intravenous fluids and electrolytes are used to correct imbalances. You have oxygen therapy, which is needed to treat low blood oxygen. Rehydration with IV fluids is often necessary to treat dehydration. And medication is only used to relieve the symptoms of the disease. Supportive care and intensive care unit environment. For dengue hemorrhagic shock, patients need electrolytes, blood volume expanders, platelet concentrate, and packed red blood cells. Preventions and precautions. Residents of the Philippines are taught to wear full-sleeve clothes, long dresses to cover the limbs. They need to use mosquito nets on doors and windows to protect babies, older people, and others who may rest during the day. The effectiveness of such nets can be improved by treating them with permethrin. Curtains, cloth, or bamboo can also be treated with insecticide and hung at windows and doorways to repel or kill mosquitoes. Sleep with mosquito nets. Keep homes and offices protected against mosquitoes by keeping them airy, bright, and safe from moisture, and be mindful of cleanliness. Don't let water accumulate in flower pots, cases, plants, both indoors and outside homes. Water them only in the morning and every other day. Okay, so as Dr. Sternas mentioned, I did keep in touch with nurses from the Philippines via email and asked if they have ever cared for patients with dengue fever and asked them several questions. These interviews are from nurses and nursing students from the University of the Philippines College of Nursing and PGH, which is the Philippine General Hospital with UP. Some of the questions that I asked were, what are the barriers to prevention? What are barriers to treatment? What types of Filipino education awareness do they have in the Philippines? What are some difficulties in caring for patients? And what are some nursing implications? So this is what I learned. Problems, which include barriers to prevention. There's a lack of information and dissemination of information on proper follow-up for dengue fever and supporting programs for patients with the disease. All the tires in some areas are stuck where children play. Also, it boils down to the attitude of the people. Some of them do not practice what they preach, and not too many residents take the disease seriously and do not comply with warnings about the fever outbreaks. The Department of Health is still trying its best to raise further awareness of the disease. However, it's difficult to reach out and follow up with densely populated areas where Filipinos are far from healthcare centers. The barriers to treatment. Various problems include lack of knowledge of the symptoms of the manifesting disease. Some families will not realize that their family members are ill and do not usually know that their child has the fever in the first place. Further problems to barriers of treatment include distance and financial restraints in the barrios or far-flung provincial areas. The Philippines is a third world country with delayed healthcare system. Financial means will always pose as a threat to patient care treatment. Another problem is knowledge deficit. So another question I asked was, how much education is given to Filipino communities regarding dengue fever? An answer that I got was, based on the interactions we had with community members from different communities we've been to, almost all of them say it's just a bite from a mosquito. And what do they need to know? The nurse replied, further teaching on prevention, like throwing away stagnant water, for example, water in cans and vases, etc. Filipino citizens also need to be attentive to serious signs, symptoms, and complications of the disease. They should know that hospitals and healthcare facilities are always ready to take care of them. Okay, difficulties in caring for patients with dengue fever. Nurse 1 replied, I wouldn't call them difficult, just rigorous and challenging. Constant monitoring, which include vital signs, lab signs and symptoms, and dealing with bleeding and pain discomfort. Nurse 2 replied, I think during critical times from patients with monitoring for platelet levels, for bleeding episodes, or probably the time when the patient would need blood transfusion, and dealing with the patient's family during that time, especially when the family does not have the right amount of knowledge about the condition of the patient. So in regards to dengue fever, always remember that it's a serious viral disease transmitted by the mosquito. The infection comes in two forms, dengue fever and dengue hemorrhagic fever. It's a severe flu-like illness that affects older children and adults but rarely causes death. But dengue hemorrhagic fever is a more severe form, in which bleeding and shock occurs, leading to death. So then signs and symptoms are all here, and you always have to give nutritious foods and fluids to drinks to patients. Dengue fever bites during the day and should be kept under a mosquito net and screened during the rest periods of the illness. Screen your rooms against mosquitoes or use mosquito nets or use mosquito repellents. Just discard objects in which water collects, including tins, cans, coconut shells, etc. Do not allow water to collect in pits and areas of the houses. All stored water containers should be covered all the time, and this will prevent breeding of dengue fever. And they should always know that doctors and health workers treating cases of dengue fever should also notify the health authorities. That's it. Does anyone have any questions? Okay, thank you.
Thank you, Steph. Thank you very much, Stephanie, for an excellent presentation on dengue fever. It's always nice, to have students do things because teachers learn a lot too, because I didn't know all that about dengue fever, so it was really very informative. I wanted to say something about B&D scholars because I didn't define who they are. Dean Phyllis Hansel wrote a grant to Becton Dickinson to expose students to different cultural groups and then do global travel. We have partnerships, of course, with Denmark. We have China, Philippines. So several people applied, and they were all awarded, those who applied for a Becton Dickinson scholarship, which helped cover part of their travel expenses and when they went to the Philippines. So one of their requirements was to do a scholarly presentation if they received scholarship. So that's why we're having this global symposium. So Becton Dickinson, we thank them very much. Our next B&D scholar is Rachel Sabatura. And Rachel is going to talk about malaria, another global health problem. And I'm going to put her screen on. Thank you, Rachel.
Okay, so malaria is a significant health issue that affects the Philippines and many nations throughout the world. So today I'll be discussing the scope of the malaria problem as well as symptoms, treatment, and methods of prevention. In 2008, the World Health Organization estimated that there were between 190 and 311 million cases of malaria, with between 708,000 and 1,003,000 deaths. 3.3 billion people, which is half the world's population, lives in areas that are at risk for malaria transmission. 35 countries, which includes 30 in sub-Saharan Africa and 5 in Asia, account for 98% of global malaria deaths. And malaria is the 5th leading cause of death from infectious disease worldwide. It falls behind respiratory infections, HIV/AIDS, diarrheal disease, and tuberculosis. There are 4 different malaria parasites that are known to infect humans. These include Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Of these parasites, Plasmodium falciparum is the type that most often causes a severe life-threatening malaria. These parasites are transmitted to humans by the bite of an infected Anopheles mosquito. Malaria is found in tropical and subtropical regions where the higher temperatures allow the Anopheles mosquito to thrive. The parasites that infect the mosquitoes also require warmth in order to complete their growth cycle. Not all countries with warm climates are affected by malaria because there are regions where the Anopheles mosquito is not present. There are also countries who have been able to successfully eliminate the disease. So looking at the map, you can see that the majority of malaria is concentrated in Africa, Southern Asia, and the northern part of South America. Malaria is an issue throughout much of the Republic of the Philippines. The dark red shows areas where there is a high risk for acquiring malaria, and anti-malarias are usually advised for travelers. Light pink areas show regions where there is low to no risk of acquiring the disease. And as you can see, there's also a strong risk of malaria transmission in nearby Malaysia. In general, the highest risk is present in rural areas where there's a lower population density, less commercial activity, and more agriculture. There are certain population groups that are at a high risk for acquiring malaria. Children are especially high risk because their immune systems haven't fully developed. Pregnant women who acquire malaria have a 60% chance of miscarriage and a 10 to 50% chance of maternal death. Those with HIV or any others that are immunosuppressed are also at risk, as well as immigrants from endemic areas and their children who often return home to visit their relatives. So the transmission cycle begins with the parasite of the Plasmodium falciparum that mixes with the saliva of the Anopheles mosquito and is thus transmitted when it bites a human host. The parasite then invades a liver cell and grows within 6 days to produce 30 to 40,000 daughter cells that are then released into the bloodstream when the liver cell ruptures. After invading a red blood cell, the parasite grows in 48 hours and produces 8 to 24 daughter cells that are then released into the blood as the red blood cell ruptures. An unaffected mosquito then bites the infected host and can transmit the parasite to its next human host. Since malaria is found in red blood cells, it can be transmitted by blood transfusions, organ transplant, and sharing needles contaminated with blood. It is also possible for a mother to transmit the disease to a newborn before or during the delivery. Malaria cannot be transmitted by sexual activity or through casual contact. A little bit about the emergence of the symptoms. After being bitten by an infected Anopheles mosquito, there's an incubation period of 7 to 30 days that go by before the first symptoms appear. If a person has taken prophylactic antimalarial drugs, then symptoms may not appear for weeks or even months later. And this especially occurs with certain forms of the Plasmodium that produce a dormant liver stage parasite. And because of the long period of time between infection and the emergence of symptoms, malaria is often misdiagnosed or diagnosis is delayed. There are 2 types of malaria, the uncomplicated form and the severe or complicated form. The classic malaria attack lasts between 6 to 10 hours and has 3 stages. First is the cold stage, which consists of a sensation of cold and shivering. The next stage is the hot stage that includes fever, headaches, vomiting, and even seizures in young children. And the last phase is the sweating stage. In this phase, a person experiences sweating, followed by a return to normal body temperature. These attacks can occur every 2nd or 3rd day, depending upon the type of parasite that's causing the illness. And though it's considered the classic malaria attack, these stages are rarely observed. Uncomplicated malaria more commonly presents with a combination of symptoms rather than distinct phases. These symptoms include fever, chills, diaphoresis, headache, nausea and vomiting, body aches, and a general malaise. Severe malaria occurs when an infection is complicated by organ failure or abnormalities in the patient's blood or metabolism. There are various manifestations of this severe form of malaria. One is cerebral malaria that results in abnormal behavior and changes in consciousness. Severe anemia and hemoglobinuria can also occur as a result of hemolysis. And acute respiratory distress can also occur, as well as abnormalities in blood coagulation. Some other issues related to severe malaria include hypotension, acute kidney failure, hyperparasitemia, metabolic acidosis, and hypoglycemia. Malaria should be suspected based upon a patient's travel history, symptoms, and exam findings. However, it's definitively diagnosed based upon finding the Plasmodium parasite in the blood. The most common way to do this is by viewing a blood smear using stain and a microscope. In this photo, you can see a large white blood cell on the left and then several red blood cells on the right, 2 of which are infected by the malaria parasite. And another method is by using special test kits that detect antigens that are derived from the malaria parasite. And these kits work quickly and usually produce results in only about 2 to 15 minutes. But some issues that need to be addressed with these tests include improving their accuracy and lowering their cost. It's recommended that any positive test is followed up with a blood smear to verify the results. According to the World Health Organization, Southeast Asia uses 41% of these tests, with Africa consuming only slightly more at 44%. Polymerase chain reaction, or PCR, can be used to detect parasite nucleic acids, but often results aren't available quickly enough to be helpful in diagnosis. This method is, however, useful for confirming the species of malaria parasite after the diagnosis has been made by another method. Serology can detect antibodies that are present against malaria parasites, which can measure a person's past exposure to the disease. Drug resistance tests can be useful to help determine which medications a particular strain of malaria will be susceptible to and how they can treat the disease most effectively. Some other lab findings that you may have with malaria include a mild anemia and thrombocytopenia, elevated bilirubin, and elevated aminotransferases. Malaria treatment has been increasingly difficult due to growing resistance of antimalarial medications. Once an effective treatment, chloroquine is an example of one of the drugs that malaria is often resistant to and is no longer being used in most endemic areas. The World Health Organization currently recommends artemisinin-based combination therapy, or ACTs, to treat Plasmodium falciparum, which is the most deadly form of malaria. 77 of 86 countries affected by this form have adopted ACT as a national policy for first-line treatment by the end of 2009. By mid-2010, 70 countries were distributing ACTs within their general health services. There is currently no vaccine for malaria. As with dengue, one of the main forms of prevention is vector control. And there are two methods that are most widely used to achieve this purpose. One is the public distribution of long-lasting insecticide-treated nets, and this method can be cost-effective and easily implemented. Indoor spraying with residual insecticides is one of the best ways to rapidly reduce malaria transmission. It's best when 80% of the homes in the target area are sprayed. These insecticides can be effective for about 3 to 6 months, depending on the chemicals used and the type of surfaces that are sprayed. Longer-lasting insecticides are currently being developed. And just as there are issues with malarial drug resistance, mosquitoes are becoming resistant to certain insecticides as well. Another method to prevent the spread of malaria is by destroying the habitats where the mosquito larvae develop. Some ways to do this are by filling in depressions that collect water and draining swampy areas. And as Stephanie mentioned, it's also important to review or cover any standing containers such as cups, trash bins, or anything else that can collect water and provide an entertaining environment for the mosquitoes to breed. And it's also important to educate the people who live in the endemic areas and gain their trust in order to implement the program successfully. So if you would like any more information, you can visit the Center for Disease Control and Prevention, as well as the World Health Organization. Or to find out about programs striving for the control and prevention of malaria, you can visit the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And I'd like to especially thank the Becton Dickinson Foundation, who made my study of the Philippines possible, as well as the University of Philippines College of Nursing and UP General Hospital that allowed us to have a wonderful experience. So, thank you.
Thank you very much, Rachel, for an excellent presentation. Now we're going to move to 3 students who are taking independent studies. They came back from the Philippines and had such a great experience. They said, I want to learn more about some public health problems that I learned about when I was over there. So, Aleena Paragas, who's the sister of Philip, is going to talk about tuberculosis, and that's a really big, important one. So, Aleena, would you like to come up to stage?
So, what is tuberculosis? Tuberculosis is a chronic or acute infection caused by a bacteria called Mycobacterium tuberculosis. The bacterium has a rod shape. Tuberculosis mainly affects the lungs, but can also attack the kidneys, bones, lymph nodes, and even the brain. Left untreated, each person with active TB disease will infect on average between 10 to 15 people each year, but not all people infected with the TB bacilli will become sick with the disease. Global TB incidence has seen a reversal since 2004. Most recent global estimates indicate that some 9.4 million people are still suffering annually from TB, resulting in 1.3 million deaths. Approximately 1.4 million TB patients are co-infected with HIV. TB in the United States. A total of 11,181 TB cases were reported in the United States. TB rates in reporting areas range from 0.6 to 8.8 per cases 100,000 population. California, Texas, New York, and Florida each reported more than 500 cases for 2010.
Combined, these 4 states accounted for 5,503 TB cases, or nearly half of all TB cases in 2010 in the United States. Global and regional incidence. The World Health Organization estimates that the largest number of new TB cases in 2008 occurred in the Southeast Asia region, which accounted for 35% of the incident cases globally. However, the estimated incidence rate in sub-Saharan Africa is nearly twice that of Southeast Asia region, with over 340 cases per 100,000 population. An estimated 1.7 million people died from TB in 2009, and the highest number of deaths was in the Africa region. Estimated TB incidence, prevalence, and mortality. The incidence in Africa has 340 cases per 100,000 population. Americas with 29 cases per 100,000 population, and Southeast Asia is 180 cases per 100,000 population. There are 22 countries in the world which make up 80% of global tuberculosis cases. For example, China, India, and the Philippines. Next. So tuberculosis in the Philippines. The Philippines ranks 9th among the 22 high-burden countries for tuberculosis globally as of 2008. The Philippines is one of the 7th high TB burden countries in the Western Pacific region. TB is the 6th greatest cause of morbidity and mortality in the Philippines. In 2007, approximately 100 Filipinos died each day from the disease. Predisposing factors such as poor housing, malnutrition, parasitism, dust and fly problems, and economic conditions contribute to the prevalence of the disease in the Philippines. There are 2 stages of TB, which develop primary and secondary. In primary TB is inactive stage. There are no symptoms, and tuberculosis will not be contagious. The immune cells may destroy the bacteria before it develops. The immune cells will form a wall, and the mass will stay in one spot. Nothing will happen unless the immune system weakens, which will cause the tubercle to open and the bacteria can multiply. The tubercle will collect calcium deposits and will be called a Gone focus. Over time, the tubercle will heal, but scars will be left on the lungs permanently. When bacteria multiplies, symptoms will occur. And then, secondary stage of TB. In this stage, the dormant bacteria will multiply and destroy the lung tissue. Bacteria may also spread to the rest of the body through the bloodstream. Tubercles will continue to develop and destroy lung tissue. Coughing of blood and phlegm may happen in this stage. The signs and symptoms of TB. In the primary stages of TB, there are no symptoms. General stages of TB, feelings of sickness or weakness, weight loss, fever, and night sweats. Pulmonary TB is coughing with mucus, chest pain, coughing up blood, shortness of breath, and wheezing. How TB germs are spread. TB germs are passed through the air when a person who is sick with TB disease coughs, sings, sneezes, or laughs. To become infected with TB germs, a person usually needs to share air space with someone who is sick with TB. For example, a person who lives, works, or plays together. The amount of time, the environment, and how sick the person is all contribute to whether or not you get infected. In most cases, your body will fight off the germs. So how TB germs are not spread. They're not spread through quick casual contact, by sharing utensils, by sharing cigarettes or drinking containers, exchanging saliva, by shaking hands, or using public telephones. People who are at risk for TB are elderly, infants, people who are malnourished, people who live in close quarters, healthcare workers, long-term hospital patients, prison workers, prison inmates, and people with weakened immune system like HIV/AIDS. So prevention. TB is a preventable disease even in those who have been exposed to an infected person. Skin testing, PPD, for TB is used in high-risk populations or in people who may have been exposed to TB, such as healthcare workers. A positive skin test indicates TB exposure and an inactive infection. People who have been exposed to TB should be skin tested immediately and have a follow-up test if the first test is negative. Prompt treatment is extremely important in controlling the spread of TB. Some countries with high incidence of TB give people a BCG vaccination to prevent TB. Educating the public on strategies to prevent TB is a type of prevention. Treatment. The goal of treatment is to cure the infection with drugs that fight the TB bacteria. Treatment of active pulmonary TB will always involves a combination of drugs. Usually the treatment will last for 6 to 9 months. TB disease can be cured if the medicine is taken as prescribed even after you are no longer feel sick. The most commonly used drugs include isoniazid, pyrazinamide, ethambutol, and rifampin. Another form of treatment that is also used in the Philippines is TB DOTS system. Tuberculosis is curable, and TB DOTS directly observed treatment or therapy. It's proven to be the most successful and cost-effective treatment strategy. The objectives of the TB DOTS are to decrease the risk of infection, reduce morbidity and transmission of infection, and prevent TB deaths. Achieving these objectives through the DOTS strategy is simple. Identify TB cases in communities around the world. Treat TB cases by directly observing their medication intake for 6 to 8 months. And TB DOTS strategy focuses on the following operational targets. Detect at least 70% of new smear-positive TB cases and cure at least 85% of the cases with direct observational of treatment. It is anticipated that 80% of deaths attributed to TB worldwide will be prevented. So summary, TB is a major global health problem. TB infection is not the same as a TB disease. It is not easy to spread TB germs to others. Usually you have to be around the person with TB disease for a period of time to become infected. If you have been infected with TB germs, taking medicine will keep you from getting sick with TB disease. TB can be prevented, treated, and cured. Through prevention and treatment, the global health problem can be managed. That's it. Any questions?
Excellent presentation, Aleena. Thank you very much. Now, Sam would like to tell you a little about Sam Quevedo, how malaria is different from dengue fever, because they both happen through a bite from a mosquito, but there are differences. So, Sam Quevedo, we welcome you to come to the podium and give your presentation.
Since malaria and dengue are both very well-known tropical diseases, they are often mentioned together but confused, but they are vastly very different diseases. For one, malaria and dengue are usually found not in the same locations. While dengue is predominantly found in urban areas, malaria is not. And while both dengue and malaria are generally spread by mosquitoes, the type of mosquitoes that spread these diseases are different. So let's start with this PowerPoint. No, that's good. That was just my introduction. The different types of mosquitoes, dengue fever. Dengue is usually transmitted by the mosquito Aedes aegypti that Steph mentioned, and these mosquitoes also are able to transmit yellow fever. They can be distinguished by white markings on their legs and on their thorax. Malaria is a mosquito-borne infectious disease by humans. Disease humans can cause by erratic purges of the genus Plasmodium. There are approximately 460 recognized species, while over 100 can transmit human malaria. Dengue fever is a mosquito-borne disease caused by a virus. The disease is found in most tropical and subtropical areas, including some islands in the Caribbean, Mexico, some countries in South and Central America, the Pacific, Asia, and parts of tropical Africa. Cases originating in the United States are virtually unknown, but occasionally residents from other visiting countries with dengue fever may come to this country with it. Malaria is a mosquito-borne disease caused by a small one-celled parasite called Plasmodium that can infect and destroy red blood cells. 4 different types of Plasmodiums can cause this disease in humans: Plasmodium falciparum, Plasmodium malarium, Plasmodium ovale, and Plasmodium vivax. So where is dengue and malaria? The disease in dengue fever occurs mainly in tropical Asia and in the Caribbean, usually during the rainy seasons in areas of high numbers of infected mosquitoes. Some 2.5 billion people, 2/5 of the world's population, are now at risk from dengue. Current estimates reveal that there may be 50 million dengue infections worldwide every year. Malaria occurs in many tropical and subtropical areas of the world, particularly in sub-Saharan Africa, Southeast Asia, and the Middle East, and Central and South America. It is estimated that nearly half of the world's population lives in malaria areas, and nearly 500 million cases of malaria occurs each year. Some signs and symptoms of dengue. Rapid development of fever that can last from 5 to 7 days, headaches, joint and muscle pains, and rash. Some cases of dengue show disorders in blood clotting, which can cause from internal bleeding. This is the hemorrhagic form. The hemorrhagic form of dengue fever is more severe and is associated with loss of appetite, vomiting, high fever, headaches, and abdominal pain. Shock and circulatory failure might occur. Untreated hemorrhagic disease results in death up to 50% of cases. Signs and symptoms of malaria. Fever is the most common early symptom of malaria. The fever tends to rise over several days and may be accompanied by headache, muscle pain, and fatigue. Temperatures of 104 to 106 Fahrenheit may be reached, and patients may experience intense shaking, chills, and sweats. These symptoms occur repeatedly for several hours every 1 to 3 days. Infection with Plasmodium falciparum can progress to severe symptoms, coma, and death. Symptoms usually develop within 1 to 4 weeks of a person being infected, though in some cases, symptoms do not appear for over a year. Treatment for dengue. Because dengue fever is caused by a virus, there is no specific medicine or antibiotic to treat it. For typical dengue, the treatment is purely concerned with the relief of symptoms. Rest and fluid intake for adequate hydration is important. Aspirin and non-steroidal anti-inflammatory drugs should only be taken under doctor's supervision because of the possibility of worsening hemorrhagic complications, and acetaminophen and codeine may be given for severe headaches and joint and muscle pain. Malaria can be cured with prescription drugs. The type of drugs and length of treatment depends on what kind of malaria is diagnosed and where the patient is infected, the age of the patient, and how severely ill the patient was at the start of treatment. Some forms of malaria from South America and Southeast Asia are less susceptible to standard malaria drugs. Here I have a list of different kinds of anti-malarial medications, and they originated with chloroquine, but new medications have been developed because of the drug resistance and the mosquitoes. Cool. Prevention of dengue. Dengue fever vaccine is in development but is not yet available. If you're living or traveling in an area where dengue fever is known to be, the best way to avoid dengue is to avoid being bitten by mosquitoes that carry this disease. You should schedule your outdoor activities when mosquitoes aren't around, like not around dusk or not around dawn. Try and wear protective clothing to cover your skin. Try and stay in like cool, air-conditioned areas or in houses with screening for protection. Apply repellent and use repellent with DEET in it. Another way of preventing dengue is through dengue traps. When we went to the Philippines, we actually saw how they made these kind of dengue traps. These traps include a black tumbler, a lanolin board, and pellets that attract dengue-carrying mosquitoes. The pellets attract the Aedes aegypti mosquito to lay its eggs into the rough part of the element strip, drenched with a natural solution, and the solution kills the eggs and the larvae. Prevention of malaria. Reducing exposure to mosquitoes, spraying your homes, sleeping under nets, covering your skin, and also spraying your clothing. The different implications for nurses. Dengue nursing interventions rely on following doctor's advice for increasing fluid intake for hydration, encouraging the patient to rest more so the body recovers from pains and aches. Patients, even after being discharged from the hospital, must still be under bleeding precautions. They should use soft bristle toothbrushes or cotton when doing oral care. not eating colored food and fluids that may mask bleeding, and monitoring signs and symptoms of bleeding, nose bleeding, black stools, or GIT bleeding. The body needs 3 to 3.5 milliliters of water daily. As the body has sensible and insensible water loss, more water intake for the patient who's sick with dengue fever. It surely aids in speedy recovery with the patient. Malaria. Patients should be monitored for vomiting for 1 hour of admission or any anti-malarial drugs. Symptoms based on treatment with tepid sponging and acetaminophen admission lowers fever, thereby reducing the patient's propensity for vomiting and these drugs. You should also check for nausea, dizziness, and sleep disturbances because they're common. Pregnant women, young children are unable to tolerate oral therapy, and non-immune subjects with suspended malaria should be hospitalized. If there is any doubt to the identity of infecting malaria species, treatment for falciparum malaria should be given. A negative blood smear does not rule out malaria. Thick blood films should be checked 1 to 2 days later to exclude any diagnosis. Non-immune subjects with malaria should have daily parasite counts performed until negative thick films indicate clearance of parasites. Any questions? All right.
Thank you, Sam, for your excellent presentation, and I like your little drawings. Our final presenter is going to talk about malnutrition, which is a big global health problem. And Ms. Rondinella, would you come, please?
So, malnutrition as a global health problem. So what is malnutrition? Malnutrition is defined as the insufficient, excessive, or imbalanced consumption of nutrients. According to the World Health Organization, malnutrition is the gravest single threat to global public health. Malnutrition is a broad term referring to both undernutrition and overnutrition. Malnourished individuals suffer from undernutrition if their diet does not provide them with adequate calories and protein for maintenance and growth, or if they cannot utilize completely the food they eat due to illness. That's the most common. People are also considered malnourished if they consume too many calories, in which they suffer from overnutrition. So some general statistics on malnutrition. According to the Food and Agriculture Organization, the number of people globally who were malnourished stood at 923 million in 2007, an increase of over 80 million since 1990 to 1992 base period. The World Health Organization states that malnutrition is by far the largest contributor to child mortality globally, currently present in half of all cases. They also state that malnutrition during childhood usually results in worse health and lower educational achievements during adulthood. Every year, 15 million children die of hunger. The World Health Organization estimates that 1/3 of the world is well-fed, 1/3 is underfed, and 1/3 is starving. 1 in 12 people worldwide is malnourished, including 160 million children under the age of 5. So in the Philippines, 80% of malnourished children live in undeveloped nations that actually produce food surpluses. This is because the food they grow is being sold and they're not eating it by themselves. They may need materials for their homes or more money to grow more crops, so instead of eating what they grow, they choose to sell it. In 2010, 925 million people in the world were hungry. Asia and the Pacific have the highest number of hungry people at 578 million. Sub-Saharan Africa has the second highest number of hungry people at 239 million. Latin America and the Caribbean are third with 53 million. Near East and North Africa have 37 million, and developed countries have 19 million. So some causes of malnutrition are poor diet, not eating enough food, or eating foods that don't provide the individual with the nutrients required for good health. Mental health problems. People with depression may choose starvation or overeating as an unhealthy coping mechanism. And also anorexia and bulimia. They develop into malnutrition because individuals aren't ingesting enough food. Mobility problems. Some people suffer from malnutrition because they can't go buy the proper foods or preparing the food is too big of a task. They can't get to the kitchen because they're in a wheelchair or something. Digestive disorders and stomach conditions. Some people eat properly, but their bodies can't absorb the nutrients. Examples are Crohn's disease and ulcerative colitis. Alcoholism. Long-term addiction develops into gastritis and pancreas damage, which affects the body's ability to absorb and digest the food, certain vitamins, and it also affects the body to produce the hormones to regulate their metabolism. In third world nations, some causes of malnutrition are food shortages. It's caused by a lack of technology for fertilizing and growing crops, food prices and food distribution, high prices of food, and ironically, as I said before, 80% of malnourished children live in developing nations that produce food surpluses, and it's because they're selling it instead of eating it themselves. And also lack of breastfeeding. In third world nations, they tend to abandon the idea of breastfeeding because of an improper latch or for pain and discomfort. So who's at risk for malnutrition? Elderly people, especially those in long-term institutional care or those who are hospitalized, people who are socially isolated, low-income individuals, people with chronic eating disorders, bulimia and anorexia, or people recovering from a serious illness or condition. Some signs and symptoms are a loss of fat, breathing difficulties, depression, reduced muscle mass, fatigue, irritability, decreased skin turgor, sunken eyes, and hair loss. So some treatment strategies. First, the type of malnutrition treatment recommended depends on its severity and whether or not the patient has an underlying illness in which the condition or illness needs to be addressed first. A care plan needs to be set and it should include a feeding program with a specially planned diet and, if necessary, nutritional supplements, and they need to be monitored very closely. And finally, a diet tailored to the patient is important. If there are still nutrients the patient is missing but can't incorporate into the diet, they need to take oral supplements. An example would be like a vegetarian or a vegan. Prevention strategies is to eat a good, well-balanced diet following the food pyramid. And there's a picture. Any questions?
Rebecca, thank you very much for your excellent presentation. I want to thank the students for a fabulous set of presentations.